DTHF Research Meetings, your deep dive into the latest in research.
Hi, welcome to our first research output meeting of 2024. Today we have a great presentation on the FASTPrEP project, which is part of Desmond Tutu Health Fund, one of Desmond Tutu Health Foundation's larger projects are going on at the moment. So I will just introduce the three speakers that we have today. Elzette Rousseau is a social behavioral scientist at the Desmond Tutu Health Foundation and a PhD candidate in behavioral medicine at the University of Cape Town. She is the adolescent division lead at DTHF and is a co-investigator on FASTPrEP, where she also facilitates collaboration with the FASTPrEP Youth Reference Group to ensure their meaningful engagement in the adaptation of the intervention and the design and implementation of research activities. Elzette has been involved in implementing and evaluating community-based sexual and reproductive health services for adolescent girls and young women for close to 10 years and PrEP for the past 6 years. Then our other presenter is Pamela Fuzile. She is a research administrator for the FASTPrEP project. She was also accepted into the 2024 AVAC Advocacy Fellows Program this year, which offers intensive support to emerging and mid-career advocates to complete an advocacy project focused on HIV prevention and global health equity. Congratulations on that, Pamela. Our third speaker is Likona Matutu. She matriculated in 2020. She's currently 21 years old. She's a HIV prevention ambassador and has been a member of the FASTPrEP Youth Reference Group for more than 2 years. And with that, I will hand over to our speakers. So I will mute myself and over to you.
Thanks so much, Nadine. And thanks everyone for joining today. So we are going to speak about this topic called Youth Are Experts in What They Need. And we're going to share some of our experiences of setting up the Youth Reference Group and what best practices are. So I've indicated here all the people involved in this paper, which includes some of our Youth Reference Group members, which I'll explain a bit later. Sorry, we're just waiting to progress the slides. Thanks. So to start off as a background, Ntando Yola, who is not here today, and myself started conceptualizing the concept of the FASTPrEP Youth Reference Group in 2020, when we were still busy planning what this large-scale implementation science study would look like. And we were thinking about how do we move engagement with young people beyond a tokenistic engagement. So if we look at recent literature, we will see that there is a call from the World Health Organization to have expanded health access strategies, including that for PrEP, if we want to reach the very ambitious targets that was set for, not 2023, sorry, 2030. There's an issue in my slide. So effective HIV prevention requires well-designed, well-targeted, and people-centered services. And people-centered services are defined as services that are approachable, acceptable, available, affordable, and appropriate for the people that you are having the services for. When we want to look at what active collaboration and engagement with adolescent young people look like, we know that it is very crucial if we really want to, as I said, design and implement, as well as evaluate PrEP programs. So while we have seen in various research studies or programs that's been planned that there is an inclusion of young people, we see that frequently, maybe in like a youth community advisory board, the youth CABs. Adolescent young people have said that they desire to be much more involved in decision-making that goes into HIV. And also to put forward that engaging youth can have positive and large impacts on research, on programming, and then ultimately also have an effect on HIV response in this population, as has been indicated by a few studies in recent years. Okay, so just for those who are not aware, I've been speaking about FASTPrEP quite a bit. So FASTPrEP is an implementation science project aiming to improve the uptake and optimal use of PrEP in 15 to 29-year-olds. So we are targeting a big cohort of young people, more than 20,000. Most of them are adolescent girls and young women. We're also including pregnant women or breastfeeding women, men who are the sexual partners of young women, as well as men who have sex with other men. So this project, as it currently stands, is a differentiated service model where young people can get services from different spaces, and they can move around between the different spaces. So as I said, this program is there to see how can we improve uptake and optimal use of PrEP, as well as understanding how do we get to the best model for young people. So this project was implemented in 2022. But the year before that, in 2021, while we were still busy planning this project, we decided that we don't want to just plan this project based on recent literature or even just recent pilots that we were involved in, but also include understanding from young people of what is the service that they want. So we did a discrete choice experiment with just over 300 young people. And then we also created the youth reference group of about 80 young people at that stage. So the young people in the youth reference group were 16 to 29 years old. We purposefully recruited them from mobile clinics, from youth-based community projects, from antenatal care, health services, and from key population safe spaces. So we aimed then to have these 4 subgroups. So we had adolescent girls and young women. As I said, pregnant women was another group, the MSM, and then male sexual partners. We also used some snowball sampling because we know that some of the people, because of just the work that we do, that we would engage with, were people that were maybe already PrEP experienced, and we wanted to ensure that we had some PrEP naive people also as part of the youth reference group. So the discussions are also about how do we, if I say that the project is aiming at how to increase uptake, we also needed to engage with people who were not yet using PrEP. And so this went through UCT ethics, and we have a waiver of parental consent for the 16 and 17-year-olds. And then to add, as I said, this was something that we wanted to do, and it developed over the years, and it is still developing as we try to see what does this youth reference group engagement model look like. So first phase, what we call the planning co-creation phase, was in 2020 and 2021. So that's before there was any implementation science project. And that's where we did the formative research. And this was in the form of having various focus group discussions with the youth reference group and posing questions to them around service delivery, barriers, facilitators, them getting involved in co-creating what those services look like. They were involved in deciding what were the different spaces, as I showed earlier, where PrEP would be delivered from, whether it's the mobile clinic or the courier service, etc. So that was the first phase, and we completed that phase. And initially, we first thought lots of spaces, a lot of implementation sometimes ends there when they get the information and then move on. But then we have kept the youth reference group going. So beyond 2021, we have now engaged with them as youth reference group, like expert consultants. So now they are still co-creating with us, but when they co-create now, sometimes it is to do with services, but it really drills down into lots of the different pieces about service delivery. So they get involved in content planning, in demand generation, in introduction of new tests or new HIV prevention products, what counseling look like. So all the different components. So we consult with them very frequently, sometimes as frequently as every 2 weeks, to get that feedback from them. And then it is a combination of them getting involved quite early on in something that we are want to bring into the services, or sometimes it's just them evaluating or approving when it comes to social media content, for example. And then more recently, we've also added in, so this was from about last year, using the youth reference group for what we call member checking. So checking with the youth reference group member, you have designed this. Are we actually doing this in the way that you said this should happen? So we do that in two different ways. We use them as secret shoppers. So as secret shoppers, the youth reference group do not really know the implementation team. They know the research team much better. So they will go out to some of the mobile clinics. The mobile clinic staff might not know that this is someone from the youth reference group. They will just think this is a normal client coming. And then they will go through the process and provide feedback back to Pamela, mainly about what worked for them when they were there, what didn't work for them. And then we can change services to like constantly know, like, the services is on par with what young people want. And then also we've started, now that we are starting to have some research outputs, to also check in with them and see what is their reaction with the presentation that you are seeing today. I'll explain that a bit better on the next slide. So that's the model we have implemented. And then last year we were thinking about, we want to get some feedback on and explore what was experiences like for having a youth reference group like this. What is potential best practices? So we conducted 4 focus group discussions. In total, 26 members of the youth reference group were involved in those focus group discussions. And we had individual interviews with 8 of the project implementers, and that included clinical and research staff. So then our analysis included, after doing those focus group discussions, and the questions, they were just, asking about best practices, what's working, what's not working, potential benefits, some challenges or things to consider when working with a youth reference group. After doing the focus group discussions, the research team did a first round of thematic analysis. And that was followed by engagement with some members of the youth reference group who were invited into a next level of analysis, where we pitched to them what we believe we saw in the focus group discussions, and they had some reactions on it. They assisted with interpretation of it, or made suggestions of things that we might have missed in those focus group discussions. And then after that, there was then a final thematic analysis and write up again. Now I'm going to hand over to Likona's voice, and she's going to take us over through what were some of the key things that came out as best practices with setting up and managing a youth reference group.
Okay, through our engagement, we learned a lot about our sexual health as a youth, and we learned through different ways, visual and materials. For example, when it came to the use of condoms, actually demonstrations of that. And also we also felt maybe a little bit of overexcitement regarding our maybe our input to the ideas being on the tracks and seeing whatever we've helped create being out there and actually being used. That meant that our voices were heard, and that we have an impact in creating these ideas. The engagement is not really tokenistic. So when like, it's not about just the researchers getting what they want, but also about us getting what we want, because sometimes it's us needing help from them. So we also create our own sessions so that we can get more knowledge about in spaces where we lack, really. Also, is a short course available to all of us, the youth reference, is towards being an HIV prevention ambassador, like acquiring all the knowledge that we need. And there's also counseling available to us if we have anything basically that is deeper, mental health issues maybe. The logistics and challenges of resources, that was solely based on transport, and also we had transport course in all. That was based, like, we also had a session on that, on how much does it really cost to get into the mobile trucks, how do we get there, and everything else. So that means that it's like they're interested in helping like defeat those challenges. Males also had an issue with single gender versus mixed groups, because they had challenges of maybe it's like being a man, it's not the same when engaging with women about sexual health issues. They preferred men-to-men groups. As for women, they didn't have an issue mixing men with women, young girls with women. Men also thought that, I'd like to term it like this: boys should be alone and men should be alone. And then it's more or less on a traditional side. Yeah, it goes to the traditional beliefs versus inclusivity. And then there's becoming an ambassador. It's basically what I just said, the free course on learning more about HIV and how to approach people and how to like tell them about it, and having the questions when asked about basically FASTPrEP. And also it's advocating, besides having the certificate for the course, it's advocating in the community for FASTPrEP. And especially because we also have t-shirts, especially when you're wearing your t-shirt and someone actually asks you about it, and you actually get to explain more about the program. And also like going back to like our ideas being on the trucks, then you get to point out, okay, I was part of creating that. So yeah, thank you.
Thanks. Just before I hand over to Pam, I think you missed something very important, which is about the resources needed. You spoke about the logistics, but also best practice is to adequately pay youth when you engage with them, and at each engagement in viewing them as experts.
Yeah. So what made it easy for the team to kind of recruit was the fact that Desmond Tutu was well established in the community. So it was easy to kind of recruit young people, whether they are pregnant, like Elzette mentioned, MSM, and young people that are still in school. And we were very flexible in terms of the times that we meet them. For instance, we know that Fridays are short days for school. So we would meet them Friday afternoons because it's better to meet them. And also currently the almost like a centered space in Philippi is currently Philippi Village, because it's easy for young people to get there. But also what we learned was that sometimes it's not always the feedback that they gave. Like Elzette mentioned, we have secret shoppers that will go to the mobiles to see if what they have requested is really out in the mobiles. So the feedback is not always well received by the health professionals, because they're also not really used to be told or to be advised by participants how to render their services. And in terms of recruitment, it's always ongoing, because young people, there's a lot going on in their lives than just one thing. So they get new jobs, they change schools. So recruitment is ongoing all the time. And in terms of agency versus consultation, there are things that we don't usually need them physically to speak to them. We can speak to them via WhatsApp, like in terms of maybe social media posts, or we are creating a poster that's not urgent, so we would communicate that via WhatsApps. But like Likon has mentioned, not all conversations or not all sessions that we will have with them are coming from a researcher's point of view. They also sometimes request some things that they would need assistance with. Like for instance, this coming Friday, we are talking about family planning, and that has nothing to do with just the researcher's point of view. So it doesn't just benefit young people, us as researchers, but them as young people as well. The early involvement of young people in co-designing or creating implementation science studies, it was very helpful because it almost leads us to how do we best serve our community. And the other benefits would be it creates some sort of independence. Then myself don't always have to facilitate those sessions. For instance, now we know that Likwana can lead those sessions and other young people can lead the sessions. Then it's a sort of from youth to youth kind of session or setup. Training and capacity building in terms of, like Likwana mentioned, it's not just us taking from them, but they also get trainings. For instance, they have the PrEP training, online training, and whatever training that they may need. For instance, they also asked for computer trainings. They also asked for facilitation trainings so that they are also able to lead those sessions. Thank you.
Okay. And so as we get into the conclusions and recommendations, I'll just also, so I'll just highlight a few things again. I think one of the conclusions, as I said, it's a learning process, but we go into it understanding some tensions. There is always a tension between researchers, PIs, the implementation team, the young people that we are serving. But I think what we have learned is really, it pays off to prioritize consultation with your target population above urgency. So in running a program, there's frequently things that's urgent to roll out, urgent to get a social media post out, urgent to try a new test or to do task shifting in a clinic. But what we've just seen is that it's better to just take a moment and engage with the youth reference group in that, because then you always know that you're on target. So for example, in FASTPrEP, we are not struggling to get young people through the door. We have more than 11,000 people that have started on PrEP since 2022. And then we've also learned about authentic youth engagement and really what is tokenistic youth engagement. It shouldn't just be a checklist that we can say to ethics, yes, we spoke to young people. Engagement is much, it's much deeper. It goes much further than that. It's not as researchers showing up and you already have the idea and you just want a stamp. It is going in there and being open to be told to do something completely different to what you thought about. And then just lastly, to again, just note those things about the importance of approachability for optimal engagement. There are some diversity challenges. There are perspective challenges. Pam touched a little bit on the need for sensitization. So even within a team that is sensitized to being adolescent friendly, etc., adolescent friendliness maybe from a clinical or a research person doesn't necessarily mean that they view the opinion of a young person at the same level as their opinion. So it's a lot of that sensitization about where expertise lies when you want to co-create with young people, and then logistic challenges, as we've mentioned, and then resource limitations to have frequent engagements and adequately reimburse young people. And then some of our next steps, we are continuing to document, what does a youth reference group model look like, and can we formally document it more so that it can be rolled out beyond this specific project. Likona spoke a little bit about some of the education that's done in the youth reference group, and we've seen some of them now starting to move into being PrEP ambassadors, but there's also some of them that's engaged with researchers now so frequently that we start thinking about, is there something like, what's the possibility of employing community investigators? And these young people start joining us as full investigators on some of our studies to constantly check us or keep us going in the right direction. And then finally, as was mentioned in the beginning, that Pam was just selected for the AVAC 2024-2025 fellowship, where she will be taking this idea of a youth reference group to a national level, and she got a funded project to see what can that look like. Can we engage a youth reference group at a national level when it comes to introduction of new HIV prevention products in the country? And we are happy to take any questions to either one of us. Thank you.
Okay, thank you so much for that very nice overview and presentation and all those very important points of how to engage, best engage youth reference groups. I will open up the floor for questions. You can just unmute yourself or type the question in the chat. There is one question already. I'll just read it out. How is the youth reference group compensated? Was the question. If you can comment on that.
Okay. So they're not fully employed. So we compensate them like how any company would work with a consultant. So we compensate them for time spent. So they get compensated for their transport to come to sessions at a community-based venue, but then also for the time that they spent there with us. That's how for each engagement, we will compensate them. So if in a month we see them once, they'll be compensated for once. If we see them 5 times, they'll be compensated for 5 times. I don't yet think we do this perfectly. And I think there's more to explore and to do with regard to that. It is also, these are things that needed to be built into budgets. So I think that's part of what we're trying to do, to also promote how important youth reference groups is, so that we start building those into our research and program budgets.
Okay, thank you. We have another question in the Q&A. I'll read it out. How do you ensure adequate training if you have a high turnover of young people?
So to just first say, when young people enter, we don't necessarily think that we have to train them, because we believe that they are coming in as experts of their own lives. So our initial engagement with them is in the sense that they are experts, and we don't need to train them on what it means to be a young person. So the additional training we are giving them is more related to when they want to move more into being a PrEP ambassador, where they start taking the message out there to other young people, or when they indicate that there are certain things that they would want to upskill themselves in.
Okay, we have a question for Pam specifically. What were some of the first things you would suggest people do to build the kind of relationship you have with the youth reference group to ensure it's professional but friendly?
I think I will touch on what Elzette just mentioned, that young people are already experts of their lives, and therefore we don't need to treat them like children. So if we can respect them more and understand that they bring more to us than we give to them, I think that will help. I think the problem that we find is that our health providers act more like parents than their friend or someone that they can open up to and speak to. So if we can just realize and learn that they are experts, they are not as clueless as we think they are. I hope that answers your question, Lauren.
Yeah, if everyone, does anyone have any other questions? You can raise your hand, you can unmute yourself and ask directly, or you can type it in the Q&A or the chat. Okay, Bernard, who's in the room with us, you can ask your question.
Yeah, so thank you for the presentation. I'm just curious about the room for innovation, because I think the HIV prevention space, there's like a lot of things that come up in the pipeline. How do you deal with this, especially with the youth, training them on like new methods and room for accommodating them as well?
So actually our youth reference group has gotten involved with organizations beyond the Desmond Tutu has become aware that we have this youth reference group. So we have had at times pharmaceutical companies have asked to have engagement with them. So the youth reference group has engaged with some pharma companies, but that will to date it has been on packaging, for example, how to introduce new products, and some of it includes products that is not yet widely available in South Africa. But other than that, they're not getting that much involved in like what a product should be like. But because in FASTPrEP we are introducing products as they become available. So currently in FASTPrEP we do have the oral PrEP, the DAPI ring, and injectable PrEP, and they were very much involved in how do we do counseling around it, how do we speak about it, what should a poster say, how do we introduce this to young people. They were very much involved in it. The model, however, of getting involved in saying what new products, I think that is something that it goes back to Pam and a project with AVAC, which is about advocacy more broadly in the country. Do you want to add a sentence to that? Just one sentence. You were saying about engagement. How do we get youth to engage with new products?
Yeah, I mean, that's what the whole advocacy is about, to learn on a national level, how do we involve young people in terms of product introduction. We do it well in FASTPrEP. It works for FASTPrEP. Can it work? Obviously, it can work nationally, but how do we do that in national level? So it's important that young people are involved from the early stages of co-creation. Otherwise, we wouldn't have over 11,000 of participants if it was, yeah.
Yeah, we do have 2 more questions at this point. In terms of geographical representation, does the youth reference group cover all areas of the Mitchells Plain sub-district?
Thanks. So that is the sub-district that we work in Klipfontein and Mitchells Plain sub-district. So not all areas have we found young people as interested to be involved in a youth reference group. So I would say there's some areas in that sub-district where we get a lot of youth engagement. There are other areas or some subpopulations that in general experience much more stigma still to speak about HIV. And so we are still trying to recruit more members from that. That is currently one of the active recruitment strategies, so that in the youth reference group, I said earlier about how we try to get certain type of more gender groups, but now we're also, and age, but now we're really also trying to focus on race representation as well in those groups. Yeah.
Okay, there's another question in the chat. Do you feel like there's hope for changing the attitudes of men regarding their sexual health, testing, disclosure, etc.? I know it's been a problem for years, especially in KZN. Don't know who wants to talk to that.
That is a big question. I do think it is again about engagement with the population that you want to serve. So I can just speak about FASTPrEP, and our youth reference group contain, as I said, young men, slightly older men, and MSM as well. And I think because of that, we've seen a lot of men come for services to get tested, to get on PrEP. So I would say we won't know until we ask. So my recommendation is there, you know, have community dialogues, have men's dialogues to hear how do men really want services to be brought to them so that there's optimal engagement.
Okay, right now there are no more questions in the Q&A or the chat. Just wait a little bit, see if anyone else has something they'd like to share or ask, comment. Bernard, here we go.
So about so the age group was between 15 to 29. So how do you deal with the transitions, especially when they are over the age of 29? Do they go to regular care? How do they continue afterwards?
Yeah, they can. So we work very closely with at least 12 government facilities in the area, in the young population, as well as to refer out. So the reason why we chose that population is just that's where the burden of HIV is in that area. Yeah, I would say. I just want to add, I know there's no more questions, but to just say again, Likona that is here with us is a member of the youth reference group. So if you want to ask specifically about how anything related to that, she can share about personal experiences if there's a question about that.
Okay, I'm just having a look if there are any other questions. Any questions for Likona? Right now. I guess I have a question. I'm not sure if you mentioned it. How large is your youth reference groups? How many members are there, or how do you decide how many to and who to select from which group, and how does that process work?
So currently, when we started, it was just 80 participants, and like we said, recruitment is always happening. And now we are sitting at 79, I think, when I checked this morning. So what happens is we invite them and say, this is what's happening this coming date, who is available. And right now, this sort of group, age group is like 18 and older. We have a very little number of young people that are below the ages of 18. So that is just one group. So we don't separate them into age group type of lunch sessions. But I will admit I was overwhelmed on one session where I had everyone, 18-year-olds and 21-year-olds and 15-year-olds, which I did not prepare for. So it's helpful to divide them and not have everyone in one session. That is ideal. Yeah.
Yeah, thanks. Okay, I don't see any more questions. Is there anything else either any of you wanted to add at this point? No?
No, we don't have. Yeah.
I think I do.
Oh, you do?
That was a hand raise, I think.
I'm sorry, but for me, it's for healthcare workers. They don't take kind to the feedback. And I think what I want to emphasize on is to always remember the service is not for you. You are the one who's giving the service. Therefore, it's important to take note when someone is saying, how about we do it this way? We realize that your way is not always the right way. So take kind to comments. It doesn't mean anything about you as a person, but it's more about the service that you give. So don't take offense. If we come back and say the waiting is too long, or if you come back and say it's not confidential, it's not about you as a person, but the service that you are rendering, and you must be able to adjust as the young people want it to be. I hope that makes sense. Thank you.
That does make a lot of sense. On that note, do you provide training on the feedback you keep on getting from the youth reference group for the healthcare workers working? How does that look like? Do you do regular workshops, or
That was
every
what
few
the
months,
team
or-
has always said, that we need to sanitize and train them in terms of understanding how, because they get secret shoppers and then all of a sudden you did this, it feels like you did this, you did that, and not more of a service. So yeah, we do every now and then trainings when people start with but we can still do more of that.
Yeah.
We can always improve in that.
Yeah, so just to add, there's the feedback of this is what we, have heard. Let's brainstorm how we could potentially change it so we are more aligned with what young people have requested. So that happens frequently, but there's definitely the need for training on youth sensitivity, being sensitive to this is a youth-led program and what that means, which is a more formal training, which includes just breaking down some potential barriers or that people might hold inside of them because of upbringing or age or any of those things.
I actually have another question. This is more of a research methodology question. How do you, if you continuously adapt and adjust your approach and your methods, how do you in the end, do you group your data into different timeframes or points where you've implemented changes to really see the impact of a change, or how do you measure any of that? Or how does, that's having a fluid kind of methodology and adjusting as you go, I would imagine would impact that as well.
Do you mean for the youth reference group model or for the services?
Just in terms of evaluating what works, what had a big impact, looking at the data that comes out of it, how do we adjust for that? Or,
So if in FASTPrEP, as the service delivery part, so it is implementation science. So we do use a specific framework that is constantly looking at. We have process notes, we have all our meeting notes. We can understand when did we make certain changes in the program and its potential effect on a number of feet through the door based on the data. With trying to capture the youth reference group model, I think we are being still very open and being exploratory, and we rather have these engagements back with them in the form of focus group discussions, etc., and constantly just asking what's working and what's not working and capturing that. But I think we are still grappling with what's the output going to be like. So this is currently a paper we are working on as an initial best practices paper, but also to think like, especially the impact part, how do you connect the youth reference group is the one that has caused the impact in your study.
okay, thank you.
DTHF research meetings, your deep dive into the latest in research.